Hello and welcome to today's webinar, Building a Scalable Integrated Virtual Health Ecosystem. My name is Lisa Young-Bates and I am a marketing manager here at Perficient. Before we get started, I'd like to cover a few housekeeping items. Today's presentation is being recorded and a link to the on-demand recording will be delivered post-webinar to the email address that you provided upon registration. The on-demand recording can also be accessed from the Insights section at perficient.com. This resource hub offers guides, blogs, and other content around trending topics on digital transformation. Also, we've provided resources you can access during this event. I hope you'll explore the handout section of your webinar interface. There you'll find a Perficient fact sheet highlighting our experiences, partnerships, awards, and end-to-end capabilities, as well as an information sheet for our virtual health solutions. We're thankful that you've taken time out of your busy day to join us. We certainly want to get to know each of you better, and in the process, we're excited to introduce you to Perficient's people, capabilities, and successes. We are a global digital consultancy, transforming how the world's leading enterprises connect with their clients in more meaningful ways and drive superior business results. We drive end-to-end success and a pragmatic approach to your digital transformation, with 35 locations around the globe, working collaboratively to deliver award-winning strategy, infrastructure, insights, experiences, and innovation. Our dedicated healthcare practice is comprised of experts who understand the unique challenges facing the industry, many of whom come from the payer or provider space, and can help you champion change and transformation across your enterprise. We are trusted by 9 of the 10 largest health systems and by the 5 largest payers in the US. And Modern Healthcare this year has recognized us as the 4th largest healthcare IT consulting firm. We have a great discussion queued up for you today. We'll kick off by discussing the virtual health continuum and its impacts on consumers and care teams. We'll then weigh buy versus build options and, importantly, knitting all of the pieces together and explore steps you can take to increase value from the ecosystem of custom and third-party virtual health offerings. We welcome your questions, so please, as we are presenting today, if you have questions for our speakers, add them using the chat feature on your screen. We'll keep an eye on your comments and, time permitting, wrap up today's discussion with a Q&A. Of course, we also welcome a deeper conversation with you following today's call. Our speakers today include David Allen, Perficient's Director of Virtual Health. David has over 20 years of digital consulting experience, specializing in the digital health space for the past 15 years, where he has helped multiple provider, payer, pharma, and new entrant clients articulate and execute their strategies for using technology in novel ways. Virtual health is a specific focus area and a passion for David, having worked on multiple aspects of this sub-industry that is now positioned for its greatest impact yet. Ron Jones serves as the Practice Director for Microsoft Modern Work at Perficient, driving collaboration, communication, and productivity solutions that improve experiences. Ron helps spearhead novel uses of Microsoft Power Platform and Teams that support virtual health experiences. And Brian Dougherty serves as General Manager of Custom Development here at Perficient, leading a team that delivers high-quality solutions for our clients, spanning business applications, modernization initiatives, and software as service products, all with a focus on understanding the business platform to solve and working as a trusted partner. And with that, I'll hand the presentation over to you, David. David, take it away.
Thank you very much, Lisa, and welcome everyone. Look forward to the session here and especially to what I hope will be some interesting questions at the end here. So it's a very exciting time in the virtual health space, as we all know, and to set the perspective here, a lot of our focus today is around what we see some of the big categories of opportunity for us all in this space as virtual health goes through a period of significant growth. So just to set the scene for the conversation that we want to have today, we know that the virtual health space has seen an explosion in the context of COVID-19. So the easy number is the 10x number. We know that virtual visits as a whole, 10x is probably a significant understatement in most cases of the sheer scale of growth in the number of patients using virtual visits. What I think are slightly more interesting, maybe less obvious numbers is that something like 25% of those encounters we expect, and we and other commentators and forecasters in the industry expect, will remain virtual in some form, especially in certain categories of care and primary care and in certain specialties that lend themselves to long-term usage of virtual tools more explicitly and more expansively than historically. And in addition to that, we see a significant growth or continued emphasis on a broader definition of the virtual health space, and a kind of a halo impact of that virtual visit explosion in all of the other categories of digital health, virtual health we'll talk about in a minute. A couple of areas we highlight here would be in the patient monitoring and digital therapeutics areas. And really the point is that these kinds of experiences and interactions for patients are becoming a norm. And if you as a provider system or you as a payer are not seeing utilization and usage of these tools, it's not because it's not there, it's because it's happening somewhere else. So how do we make sure that we have the most effective grasping of this opportunity? Just making it a little bit more come to life than just virtual visits. That's going to be a couple of theme that we want to kind of get across at the beginning of this. Is it's a lot more than just the virtual visit itself. So what do patients and providers really want to be able to do? We want to be able to obviously make virtual visits easy to schedule and easy to execute. That's the kind of table stakes in itself. What I think is a lot of the areas underneath there are areas that have been, to a greater or lesser extent, more experimental in nature or more kind of limited in nature historically, but we see some of the halo impact really starting to drive much more utilization and adoption of these tools. So things like tracking your health and wellness, collaborations across care teams. So there obviously have been for a long time many capabilities in that area, but that whole concept space of more effective care coordination across providers and across specialists is a big area of growth for virtual health. In addition, managing conditions with technology. So we know that we've had the remote patient monitoring space for a long time, but the scale and adoption and opportunity for that is being fed, and kind of an inflection point by the growth in virtual visits. So see a lot of growth there as well. And then finally, all of the avoidance of waste opportunities for virtual health that again have been sitting in the wings for a while are now a big focus in terms of simple things like minimizing missed appointments, but also, for example, the entire space of medication adherence. The point being that as we think about this space, the virtual health space is the poster child for this space is the virtual visit, but increasingly we're seeing that all of the other aspects of virtual health. So on this slide, to orient you, we're trying to make the case that virtual visits is the obvious discussion point and the obvious kind of news item. But as you move out to the left of the slide towards the patient, we're seeing, or towards the home and the patient, you're seeing a great deal more. The innovation was already there, but a great deal more adoption in how patients are expecting to be able to interact with digital therapeutics. So everything from the remote treatment to digital therapeutics to the concept of the hospital at home, through to monitoring and care coordination. So for less acute conditions or less in short-term diagnostic situations, how do we use monitoring and coordination tools more effectively and more comprehensively across populations, out to the personal digital and community digital health spaces, again, that have been operating almost in silos, and there's a lot of discussion around how and when incorporating personal digital health data is relevant, and it's a simple answer to say a lot of that data is not immediately relevant to the physician, but I think over time we're starting to see a kind of a nuanced view on that says there is a large amount of value for a provider and a provider or a payer to understand how their patients and members are interacting with those tools and what kinds of things we can infer from that activity. So as we move over to the left, we're seeing just a huge space that is a virtual health environment that's much broader than virtual visits. The flip side of that is that on the care professional side of this, we expect that the sheer volume of those types of interaction is going to drive a new need for, it is driving a new need for digital tools and new ways for those care professionals to interact with their patients and members, but also to interact with the data, both clinical and operational, that is generated by all of that activity. So the goal there being to make delivery more efficient for care professionals across the board. So the point here is to say virtual visits is, in many senses, a relatively mature component that has been brought to the fore by COVID-19, but we see a huge opportunity for a much broader array of virtual health tools. Just borrowing some words from Joe Kvedar, who many folks will be familiar with as the president of the American Telemedicine Association. I really just quote this to reference the fact that this is a fundamental change over time from the way that we think about virtual health today. So this and I like the phrase, a fully integrated digital experience that nearly eliminates various other forms of communication. I think we will have all of those forms of communication, but essentially, if you think about digital devices as a first and primary means of communicating on all topics, clinical and otherwise, then we're getting the right sort of sense about virtual health being really comprehensive in its potential impact. So the way that we at Perficient have been thinking about this, and this is really the beginning of a series here, is to think about if that's the case and the virtual health continuum is as complicated as we think it is, which we think it is, then there is an emergent orchestration challenge that I think may have been initially hidden by the successes of getting virtual visits out at scale in the context of COVID-19, and we actually talk about some of that in some of the case studies we're going to talk about with my esteemed colleagues here in a second. Some of that may have been may have been showing a faster adoption than we may have thought, but I think the opportunity here is recognizing that this is really the beginning of a much broader orchestration effort for virtual health. Now that we've got something like a normal where we have a much larger proportion of encounters being virtual, what does this mean for a health system, for a payer, in terms of orchestrating virtual health? What are the opportunity areas? And we really break it down into three. And we're going to spend most of the time today thinking about the first one. So I'm going to describe that briefly, and then the others, and then we'll dive into the meat of the session today. So we really think that there are three areas that deserve a focus as we think about orchestrating virtual health. The first is in innovating hybrid ecosystems. So recognizing that this space in particular is one where historically there had been folks who've been touching this space for a long time will reference and know the phrase pilotitis, like, a lot of usage of interesting new tools in new ways with patients, but with very small populations, more of a kind of an experimental approach. We think that now is the point that is starting to go mainstream, as it were, but that also means that there are huge numbers of third-party solutions targeting individual therapeutic area opportunities, alongside a lot of post-EHR growth in health systems, in particular in terms of thinking about CRM and thinking about the interaction of CRM with other things. So what that means is the ecosystem of entities that you're working with is growing exponentially. And we think that there's a lot of opportunity here, and the emphasis on this session today is what the role of custom development and the role of application platforms can be in driving some of that coordination, collaboration, and really being able to build some of those tools in-house and build that mindset. So that's that category. The next two, and we'll telegraph this a little bit, the next two are ones that we'll be having subsequent webinars on later, one in June and one a little bit later. The next focus area is around what we're calling curating consistent experiences. So as that set of virtual health tools grow, the sheer number of interaction points that your patients and members will have is growing, and there are increasingly large risks that in that you have a kind of a drop in the journey or a break in the journey. And I think, you know, there's been a degree of consumer readiness to accept that lots of things that have happened over the last year have been best efforts, but over time, and as that kind of 25% of encounters remain virtual, if that plays out the way we think it does, then this becomes much more of a pain point and an area to drive better consistent experiences across virtual health platforms. That's kind of a second category. And then the third category is, you know, at the back end of all of that activity generates a ton of new data sources and requires a focus on smart integration to really prove the value of virtual health. Now, the context for that one is that, you know, a lot of third-party tools are already baked for EHR integration and APIs, but less so for integration with CRM, with BI tools, and really kind of being able to track down the performance analytics associated with a given virtual health tool. So we'll spend a bit of time in a later webinar on that, but that's the context for the session today. I'm going to say a couple of things about setting up the discussion on hybrid ecosystems and how we think about driving value there. So restating here, the hybrid ecosystems doorway, as it were, for virtual health is to an extent around the age-old buy versus build questions, but with buy versus build question with an environment where the expectations are really shifting very quickly. We think that there are, and we'll talk about this as we go through some case studies and some discussion slides here, we think there are a lot of opportunities to develop key capabilities in-house, either using custom development or application platforms. There are a lot of opportunities to use those application platforms in innovative ways to orchestrate the ecosystem. So some of the things that we talked about, what are some of the roles, and we'll play through a hypothetical a little bit later that hopefully will generate some questions from you all. And then we think over time that has an approach to ecosystems that has that custom development and application platform utilization mindset really drives likely better ROI from the ecosystem of custom and third-party offerings. So just expressing some of the use cases that we think we've certainly encountered in the last year as this is starting to come to the fore. So you know, our again, to re-emphasize the focus of this session is how do we use existing platforms or develop custom solutions to target some of these use cases where in the bottom left there, speed to market is important, obviously, but has to be balanced with experience and design strategy and with integration strategy. So again, tying back to those three doorways for thinking about virtual health. The use cases that we I think are most common for the ecosystem are clinical workflow enhancements. So this is an area where there is a huge amount of opportunity, we think, for application platforms to play roles, and my colleague Ron Jones will tell us a little bit about some of the background there, some of the work that we've done there. The next one is around coordination of knowledge and information for patients, and giving them tools for navigating care is again an area that lends itself to custom development. Some of the story that Brian Doherty will talk us through in a moment will line up there. And then more broadly, I think that the last point here is where I think we anticipate our ability to get creative and our clients' ability to get creative is in thinking about extensions of patient and team member engagement touch points for those novel environments, especially virtual and telehealth interactions. So how do we build some of the tools to link together the experience, both from a ecosystem standpoint and from a leaning into the next webinar, the journey mapping standpoint. So I think what I want to do now is hand over and allow Brian and Ron to introduce themselves. I'm going to jump onto this slide, which is a case study that Brian, if you'll take us through and introduce yourself at the beginning.
Yep, thank you, David. My name is Brian Doherty. I'm a leader in our custom and product development organization. And so I'm here today to discuss this topic from a custom dev perspective, a custom dev angle. And one of the best ways to start off is with some storytelling. So what we wanted to do here is walk you through a case study. In this case, our client is a healthcare technology company that connects people with services they need to stay well, meet their basic needs, manage illness. And so the client believed in providing a direction for self-care that should be as easy as prescribing medication. So we engaged with them to develop a platform that care professionals could use to create plans for their patients. The client envisioned a product that healthcare professionals and others could use to engage with those patients and individuals, provide them with a set of highly matched resources that would keep them healthy. So in this case, we worked with them in a custom development, agile-based approach to build cloud-based software from the ground up. And this was enabling those professionals to create those personalized care plans and then follow up via text and email, all from within this custom application. In addition, part of the solution was focused on point of care integration so that, as David mentioned earlier, there was a consistent and connected journey from a patient perspective. The system developed offered an algorithmically based set of recommendations, considering things like diagnosis, address, age, gender, language, and a series of other factors. And that would give them the best possible information. And ultimately, that was part of the secret sauce, if you will, of the client we were working with. And really, that's part of the rationale for a custom development system, is you're bringing into the solution your value through software. And that's going to give you the most control to do that. As I said, it was developed using enterprise backend tools and one of the leading public cloud platforms. And the focus, again, was on a highly intuitive user interface. Users today expect what they see in their consumer-facing applications they use every day from everywhere that they interact digitally, and a custom solution gives you the ability to control every detail. In addition, it allows you to control things like third-party system integration. So in this case, EHR and direct API access, third-party service at times used for integration, single sign-ons per customer instance, not something that's necessarily easy to get and configure out of the box from other solutions. And as I mentioned before, text and email. So our client continues to evolve the platform and serve additional markets across the United States. And so ultimately, this is an example of how a custom approach gives you that control I mentioned, lets you highlight your competitive advantage and iterate based on customer feedback.
Right. Thanks very much, Brian. I think we're in case anyone's wondering, we will kind of come back to some of the learnings from each of these case studies and kind of have a bit of a structured discussion around some of the observations around custom development versus application platforms versus third-party solutions. So I'm going to ask you, Ron, to introduce yourself and talk about the next couple of case studies.
Yeah, sure thing, David. Can you hear me okay?
Yes, I can.
All right. Welcome, everyone. Again, my name is Ron Jones, Director of our Modern Work Practice at Perficient, which really concentrates on, maximizing your investment in the Microsoft 365 platform. In the next couple of stories, we're going to talk about the use of that platform and in various ways. This one in particular was a clinical use case where, if you're familiar with diabetic ketoacidosis, or DKA as it's called, when a patient is submitted into or admitted into a hospital or a health system with this particular condition, this means that from a nurse's perspective, they have to do a few different things, really concentrating on their health record, logging into Epic, and going through a very cumbersome, clunky user interface in order to enter the calculations to bring this particular patient's insulin levels down to a more tolerable level from the highs that they're experiencing at the time as a symptom of DKA. So what we were really looking for was, the ability to build a calculator using the Power Platform and Power Apps specifically to automate some of this process, pulling in data from Epic into a calculator-based app that allows us to make those calculations in a much more speedy manner. And that allows us to serve our patients more quickly, as well as being able to ease some of the stress and frustration on the tabulation side of things. Because although their nurses are highly capable individuals who make these calculations on a regular basis, it often involves a little bit of whiteboarding and some other things that we were able to take out of that scenario and simplify the outcome that we're looking for and speed up the decision making for that particular piece of care. And when you can automate some of these flows, it really does help on the clinical floor and allows them to not only serve that patient, but also cut down on the time in doing so, which is a true benefit. And at this point, often we look at Power Apps and some of those other applications more so as information worker and back of house kind of experiences, but instead we're bringing it to the clinical floor in this particular case.
Right.
Well, let's go on and talk about motivating some of our care teams as well.
Sure.
All right, so when it comes to our care team scenarios, if you're familiar with hospice care, you'd know that the range of outcomes there is pretty volatile. And although none of us are looking forward to putting any of our loved ones in hospice, we have to understand that a lot of this comes down to the fact that the longevity in a program like this could be 2 weeks spreading out to 6 months. And within that, it means that we need to make sure that the patient is experiencing the highest level of service and of care as possible. And this is coming from a variety of sources, whether it's an actual doctor to, of course, registered nurses, a chaplain, social workers, and others. And that becomes hugely problematic because now we're talking about another kind of orchestration, right? Later, we'll talk about orchestrating, activities and things around the patient, but let's just talk about appointments and scheduling for a second. Because if you're using consumer devices or if everyone's operating out of a different system, then that means that when things change around the patient, if the doctor visits or the RN visits and realizes that this particular patient might need to see a doctor the next day, that will affect that already conceived schedule. So being able to, have better health outcomes is really the goal. So what we're using here is a combination of the Power Platform for the scheduling piece of this, because we're now living in a time of COVID where we can't have large management meetings where we set the appointments and goals with all the participants. Instead, we're doing that virtually, taking these things out of the whiteboard and into Microsoft Teams, but also having that schedule, being able to react to it as things change, and ensuring better overall outcomes from a health perspective are really key. So if we can have a scenario where we can centralize all the conversations around that patient using Microsoft Teams, right? And also using the app within Microsoft Teams as a tab, then we'll have the ability to ensure the continuity of care to a certain extent, because now we have a centralized conversation at all times. We have an app where we can schedule, reschedule, and adapt to any changes within the patient's overall disposition and whatever's going on with them at that particular time. And also, we're able to use metrics to drive some of the efficiencies in the organization. And tying all these things together really creates benefits on both the care provider side of things, whether it's using things like Microsoft Teams for virtual visits and other pieces, all the way to just making sure that we are meeting the challenge of our hospice patients and providing a level of care that's not only expected, but exceeding that, which is really the outcome that we're looking for. And in a post-pandemic world, is going to be even more important.
Awesome, thank you very much, Ron, and thanks for the passion. I know we both love working with that particular client. So we're gonna shift tone a little bit now from to be a little bit more conversational within the group here, and hopefully spur up some questions if there are any from listeners. But this slide pulls out some of the considerations and impacts we have from undergoing a jumpstart offering that we work on here at Perficient, where really trying to help clients think through a concept like the DKA example that Ron gave earlier, a concept, and think about, well, what is the opportunity for that? So if you imagine that the genesis of that discussion, is that a discussion that is that an opportunity that is really a power platform opportunity? Is it something that really is a full-fledged custom development opportunity? Is it something that really is, there's a third-party tool that fulfills this but requires a bit of customization? So those are the kinds of, that jumpstart drives, helps our clients get a concept through to what's the best path forward. But along the way, we noted that when we do these, we see some common considerations and impacts from the buy and build conversation that are not necessarily intuitive or obvious. So I think we wanted to talk about those a little bit, and maybe Brian, if you could talk us through the first couple here in terms of considerations that we see when we're thinking about when we're doing these jump starts for the hybrid ecosystem.
Yeah, happy to do that. In today's world too, especially when we talk at the highest level of a solution design, there's actually a spectrum of, it's not necessarily binary build versus buy, but within the use cases, that decision still often exists. And we're going to talk, I think, a little bit more in detail, but just to kind of set the tone and set the stage here. Really, in that build versus buy decision, those first 2 points do relate closely to custom development. And on one end of the spectrum of the decision-making process is full control. You could say that's one of the lines of the spectrum you're evaluating. With custom development, you can do whatever we want, and that can actually be good and bad. Looking at that point too, that actually does set us up, though. We know we can't get backed into a corner we can't get out of on our journey with whatever we're building. So we have that full control. We're not locked in. Those are a couple of the starting points for why we often think custom dev in the solution. Ron, maybe you want to think about some or contrast that with a couple of the next points.
Yeah, definitely so, because I mean, a lot of what it comes down to is, we've also made a lot of investments over the years in some of these platforms. And while custom development can help to glue some of these things together, what we're starting to find now is that, we have third-party tools and even tools within these platforms now that are helping to kind of connect some of these black boxes that we used to experience over time, right? So when it comes to maximizing current investments, you may already have investments in the Power Platform or any other like low-code, no-code solution, which leads back to that fourth point of speed to market. Often when we start talking about things like a calculator for clinical use, that's a very specific use case to a very specific audience. And if you're looking at all of your enterprise application efforts, it may not necessarily be at the top of that stack of initiatives. But when you take a bottom-up approach where we can enable some of the people who are, SMEs for those particular processes and own a little bit more of the mind share around how we're serving our patients and customers, and engage with them and enable them quickly, it allows you to have a much better speed to market and also stay within the governance and other structures that may be within the organization.
Yeah, agreed. I make a couple of quick other points on this, and then, like Brian, you said, we'll kind of dive a little bit deeper. But in terms of third-party relationships, we're also obviously thinking here about relationships with the many virtual health dedicated vendors that are out there, and that's where I see a lot of the intersection between this topic area, hybrid ecosystems, and the curated experience topic, because you need a lot of the things that we'll identify, and I think in some ways when we get together again for the journey mapping session, a lot of things that we identify there are user experience challenges that lend themselves to being resolved by a combination of obviously the third parties, but a combination of those with application platforms and custom development. So that's the kind of the linkage here. The other thing I'll just quickly note is obviously that there are impacts and things that we tend to discover in working through these kinds of exploratory engagements with our clients that lead us to the need for thinking about integration and API strategy a little bit differently, and that's why I reference back that kind of post EHR. It's not to say that we're done with EHR, but just to say that some of those integration points are typically a little bit more established for third-party tools, but are less established for those third-party tools into CRM and BI. So we identify some of those opportunities as well. Taking a little bit of a step down, what we tried to do is just oversimplify here, and I get myself in trouble very quickly with my much more technically gifted colleagues here. But thinking about full custom development versus application platform versus third party, and we'll just talk through some of those implications when we're thinking about driving value from the entire ecosystem. And we've laid out across this table some of the big themes. So control of the core code, the complexity and timeline of a given opportunity. A big one that I know Ron is very excited about, the creative input for line of service SMEs. It's a big topic here. Use case breadth, speed to market, and then access to data. So perhaps why don't we just kind of dive into them on a line by line. So Ron, if you want to kind of share your thoughts on control of the core code and how that differs across these tools.
Yeah, definitely. I think Brian said it best, in that, like, when you're in a custom dev scenario, you have control over everything, right? The control is total, and he's going to concentrate more on that in a second. And when it comes to third party and some of the app platform use cases, the control should be just enough, right? Because not only is the user closer to the changes within the UI versus having to go through just the various dev cycles, but also you have the fact that a lot of these third-party tools and platform low-code scenarios are now providing rich user experiences. So mobility and some of those other concerns that used to be benefits on the other side of the fence are now pretty accessible, and really helping from an end user perspective. Those consuming and using these apps, they're having better experiences in a low code scenario than they used to previously. So it's just enough control for the people who own the processes to make fundamental changes, which really helps to further these things along and allow our stakeholders to treat these things as products in their own right.
Cool. Yeah, and I think there's a fair point. So I think the next one here in terms of complexity and timeline, I think Brian, you probably agree that this is an area where it's really it's important to contrast that out of the box is not necessarily less complex than full custom development. Any thoughts there?
Yeah, maybe if we do start at the right on that complexity and timeline chart, especially when we're thinking about, you know, the hopes of an all-in-one solution, we kind of come to the question: does it really meet all of your needs, or just some? And then how do you address that gap? In addition, it takes time just to do the analysis up front and say what out-of-the-box solution is going to be right for me. And realistically, and again, this is coming from someone who sees and believes in the agile evolution of software development, your true requirements are probably not baked, and your needs are really still evolving. So as those changes occur, you know, are you beholden to a vendor-specific professional services team, or do you have no options? It's you get what you get. Moving back towards the left there, with an app platform, you certainly have more control, right? You're building on top of something, and you want to make sure you have the right starting point. There's that speed to market that Ron mentioned earlier, and the question comes in is, when do you hit that 80-20 rule? And when you do, when can you, or how easily can you overcome those pieces, or does that remaining 20% really take all of the effort you have to do that? So with full dev, you've got control, but you know, you're building it all.
Yeah.
So more of it, you know, it can take longer to get started and present some complex challenges to solve that maybe in that app platform they were already there. But you can get yourself out of jams, or really have that fine-grained control where things like authentication, permission, access always comes into play. How granular can you get, or do you have to jam something into an existing model? So at location 1, a user has role X, but at location 2, they have role X and Y. That's how you operate as a business and provide your service to patients. Can you do that, and can you reflect that? You always can with custom, but there's potentially some more complexity up front.
Yeah, and I'd bring that into the next line there in terms of creative input. So it may not be an easy kind of jump to make there, but I think that is one of the what I'm getting at with a possible risk for creative input, right? So Ron, I know you have a lot of passion on this point in terms of bringing in line of service SMEs, and this is so critical in healthcare, and how both full custom development and application platform kind of enable your resident expertise to be brought into these solutions. Can you talk to that a little bit, and maybe we'll leave the other topics here and just keep moving?
No, it makes sense. Yeah, a lot of these things come down to, you know, the product backlog, as it were, or how we're building an application versus the wish list and some of those nice to haves. And while we don't want to enable people to put in functionality for functionality's sake, we do get a chance through, you know, some of these scenarios with, you know, line of business and line of service folks to put in some of the functionality that may go, you know, overlooked in some cases, and push that to the users and the people on the ground faster, which really helps in a lot of these scenarios. And of course, with the cloud, you also get to take advantage of some of those scalability challenges and other pieces that may fit into the back end of some of these systems.
Sure. Thank you. So I'll just quickly go through the other three. We're running a little behind where we wanted to be, just because we're having such fun. In terms of the contrast here, in terms of use case breadth, obviously full custom development is very wide open and gets up to the point of not really being use case, but in the example that Brian gave, it is the entire kind of product suite in some cases. Application platforms there are some parameters there. I think, you know, that's something that we help clients and determine where the right point is and what the right types of fit for a Power Platform app, for example. Speed to market. The main thing I'd say here is just that the process of contracting and then scaling up that happens with third-party solutions needs to be contrasted with, you know, potentially much faster progress on the application platform side. I don't want to put you in a box on how fast we put together that DKA example, but it was, you know, a lot of that was stuff that happened very quickly because we were able to do it on the Power Platform. And then in terms of data access, obviously it's a binary thing in terms of the contracted and controlled relationship with any data that's generated with a third party versus more open or configurable, or a different approach with anything that's built in-house. Briefly then, we'll go through this slide real quick, but this is more some of the softer implications for the same topic. So I think we encounter some governance considerations here, and I'll just pick on a couple of examples to call out here. So first of all is recognizing that custom development applications and platforms really do comfortably coexist with third-party applications and function effectively across environments. So sometimes that feels like a myth that we need to take on. And then the next three are really kind of facets of the same topic, which are, you know, the impact of having a product owner team or a development team in-house that has familiarity with working not just with third-party solutions, but with custom development and application platforms alongside someone like a Perficient is, firstly, in terms of centers of excellence that are starting to emerge in virtual health. Those individuals clearly benefit from deeper exposure to the building blocks of emergent solutions versus encountering the black box of third-party tools. Not to say there isn't value in both, but there is an impact there. Secondly, we know that there is we already talked about a significant risk in terms of application proliferation. That is going to be a challenge, and if your teams are more familiar with, again, how some of these things are built and the roles they're trying to solve, then it potentially allows us better discipline in identifying and minimizing overlaps. And then finally, that kind of maker enablement mindset, we think, contributes to a better informed product ownership and arguably a better understanding and management of virtual health portfolio of applications. I'm going to keep moving just to make sure we have time to answer any questions. The use case here, this is intended to be a outrageously oversimplified hypothetical here, but let's say we have a healthcare company. Let's think about provider or payer that has an increasingly large number of virtual health options to its consumers, patients, and members. So and we've identified an opportunity for an activity hub. So we've identified that every individual tool has a clear path, but there's no central activity hub and no coordinated onboarding across the light color boxes there, which are our theoretical set of virtual health experiences for a given patient or member. And we're just thinking here out loud about what some of the use cases for a custom development approach or an application platform approach might be. And you know, I'll briefly talk about what we see some of those are, and then I'll ask you, Brian and Ron, to just kind of give me any additional thoughts, and then we'll open up for questions. So, you know, first of all is this phrase that I learned from you, Brian, in terms of facade and glue. How do we potentially use custom development solutions to place something over these start points of some of these journeys, such that we have some consistency both of look and feel, but also a consistency of how those tools are then integrated into either EHR or integrated pieces of their data integrated into CRM or BI. So that's an opportunity area that in turn allows for some of the next couple of bullets in terms of potentially going a step further than just to pass through and doing some orchestration and monitoring of usage of some of these tools from an operational standpoint, as well as data channeling and dashboarding of how these tools are used. Now, it goes without saying that there are third-party vendors that play some of these roles and have their own set of capabilities in some of the peripherals, if you will, in the virtual health space. But our observation is that it is rarely the case that it is a one-size-fits-all for a variety of very good reasons on the client side, the provider or the payer side, and from the vendor side, where they may choose not to focus on a particular therapeutic area or whatever it is. So our observation is that this is the kind of thing where as we get underneath it, there are clear opportunities for either a full custom development approach to add value or an application platform approach to add value. So with that set up, is there any kind of closing questions, closing points you would raise, Brian and Ron?
I think all I would say here is sticking with the hypothetical and continuing to think through that, there's opportunities here where if you do go down the journey and identify the use case and think about, are there opportunities to avoid what I've sometimes called a swivel chair workflow, but how do you have your team staying in one system instead of bouncing from system to system so that they're gaining efficiency or maintaining efficiency and access to important information in the process? So there's opportunities to think through scenarios like this.
Yeah, definitely so, Brian. And another piece, of course, is just, when you start looking at third party, the back of the box will tell you that everything does everything, right? But in working with a firm like ours and others with, hands-on expertise, it allows you to avoid some of those early impediments and knock down some of those walls faster. And to Brian's earlier point, it often becomes a hybrid of, buying and extending through custom code as a good starting point versus just a holistic buy versus build. There's a lot of nuance there.
Yeah, those very, very fair points, folks. So thank you all very much for the attention so far. We're through with the formal content here, and I would open it up to questions. And I think Lisa, you had something we've picked up here.
Sure, yes, and thank you first to our presenters, David, Ron, and Brian, for sharing your vision and your insights on the virtual health continuum here today. As we're moving through this, if you do have additional questions, please drop them into your chat. I'm going to go ahead and get started with this question. It seems like a really great fit for both Brian and Ron. What are the pros and cons of doing this work in-house versus outsourcing it?
Ron, I can take the first stab at that if you want.
Sounds good.
I think it's worth mentioning kind of to start here that if I hear the question right, in-house versus outsourcing it, it's not necessarily either or. In the way that we tend to operate, we work closely with our clients. We need our clients participating to play roles like product owners, development, QA, SMEs, IT support. A lot of that really depends on organizational maturity and capacity, and the goals. So it isn't a decision in a vacuum. So framing that out, I'll say that, and then maybe some pros, from the outsourcing standpoint is, you're bringing industry knowledge, the full network of knowledge from someone from the outside and that perspective. You're gaining expertise with many platforms and the ability to even select those platforms. And oftentimes too, if it's custom development, you're hiring someone who really, that's what they do, that's their job. In my case, that's what we do, and we bring dedicated capacity and accountability. We don't have a separate day job pulling us back into that. And you also have the ability to scale up, and including multi-shore approaches and things like managed service offering for the longer term. But on the pro side of in-house is continuing to make sure we've got current practices and procedures followed and long-term ownership. So I think there's a story in there to blend all of that together. I don't know if anyone wants to add anything to that.
I think you make a very good point in that hybrid team, Brian, because although people have quote unquote day jobs and responsibilities, and also just priorities may shift. While working with a firm like ours, that means that our main focus is this particular effort, and we're able to push that along even as some of those priorities may shift. And that goes on top of the expertise we bring to the table across, at Perficient, like 40% of our business is healthcare. So we can bring in a lot of those challenges that we've seen before. Also, just additional visibility into some of those partner scenarios, whether it's Microsoft, or I know Epic doesn't really have them, but other platforms, like odds are we have a relationship within them, and we can get some of those things escalated and blockers alleviated versus some of the other scenarios where you might just be trapped at a particular blocker.
Yeah. I mean, from my perspective, I just think that this is exactly where we see a lot of activity in the product owner space that we talked about briefly earlier. That we've seen a really significant growth in the use of both in-house product owners and kind of leveraging technology companies such as ourselves for those product owner roles, because this is a space that's going to require that in droves for at least a period of time while the landscape kind of adjusts to all of the change that we talked about right at the beginning.
All right, fantastic. So the second question, David, I'll forward this one to you. And there was a mention on the hypothetical use case about journey maps. What teams should be involved in creating these, and how do the journey maps for virtual health differ from those for in-person care?
So I think the key thing is that in the journey map for virtual health, I think what we're envisaging is that you're for one thing, you're increasingly more likely now with all of the tools that are out there to have a virtual experience. If I'm understanding the right question right, you're increasingly like to have a virtual visit that might then result in a follow-up virtual health tool being recommended for you, for an app to monitor something, a companion behavioral modification tool, whatever it might be. So because the range of different experiences that may follow through from that virtual health visit are expanding, and because a much higher proportion of the population has had at least some level of positive experience, question mark around that, some of them have been a bit tricky, as we know, have had some level of positive experience of virtual health, you're starting to have an expectation of, all right, well, I could do that with a virtual visit. Why can't I do X? Why can't I engage and share X information with you? Why can't I've heard about a tool that helps me manage not my A1C levels, but my diet decisions. How do I integrate that? How do I think about that in the context of you as my professional? So those are the kinds of questions that we're starting, where previously we were maybe able to not so much ignore them, but have them on a as needed basis with patients and members. Now those are going to be more common, standard, expectations. And that's the distinction we're making between a journey map where all of the steps that you typically go through are focused on the in-person experience, and maybe a year and a half ago, the virtual experience was a standoff to one side, and then you would go through that journey mapping experience for virtual health, but most of the kind of threads that came off the back of that were back into some part of the physical experience. Now we have much more on the digital side. I think we probably have time for one more, do we, Lisa?
Well, and actually, so we have a couple more minutes. And you had mentioned also the webinar that's coming up, and was that about journey sciences? So tying into that?
Yes. So
you were just talking about?
We have, I think is it June 10th? We have a follow-up webinar that's focused specifically on approaches to journey science in the context of virtual health. Yes.
Okay, fantastic. So let's see, really quickly, as our healthcare panel expert, David, what does the EHR, or how does the EHR best fit into the expanding ecosystem?
So I think that the main focus there is, and I'm going to oversimplify and say that many of the third-party tools that we're talking about in this space are typically ready built with APIs for EHR. The opportunity and the role here is how do we ensure that when we build this integration, we have access to data from some of these tools or some of these things that we build ourselves that is both for the benefit of the EHR clinically and in a de-identified form or whatever form that we're able to is consumable for the CRM, for the business intelligence, from an operations standpoint. That's the distinction point. I think the EHRs obviously have a huge role to play more broadly in virtual health, and in many cases have brought their own offerings to the table for virtual visits, for certain behavioral tools, etc. But it's quite a different competitive environment and quite a different operating landscape for some of those tools than straight EHR, and they just need to be we need to be very flexible in how we think about that.
All right, fantastic. Well, we are at time. And again, I want to thank you for taking a moment out of your busy schedule to join us today, everybody. We welcome an ongoing conversation with you, and following this call, we'll send additional information as well as a link to the recording of this webinar. On behalf of our entire team at Perficient, we hope you stay safe and enjoy the remainder of your day.